Hi, my name is Rhonda, and the question I want to ask you is the removal of life support euthanasia? This has been an ongoing debate for many years and has also led to the legislation in some states which will allow a person to request assistance from their physician to end their own life. According to the Center for Disease Control, nearly 2.5 million people died in the United States in 2007. Over 500 of those deaths were caused by cancers, and nearly 75,000 deaths were caused by Alzheimer's disease. There is no data to support how many of those deaths came about because a patient or their proxy chose to end life-sustaining treatment. In thinking about end-of-life choices people make, it is important to remember that it is the right of all persons to refuse medical treatment, even if it means they will die. In an article in Critical Care Perspective, John Lucey explains that in the United States, the withholding and withdrawing of life support is legally justified primarily by the principles of informed consent and informed refusal. The principles hold that treatment may not be initiated without the approval of the patient or a surrogate, and that patients or their surrogate may refuse any or all medical treatments. What this is saying is that the patient or family can choose to discontinue life-sustaining medical treatment even though the cessation of treatment will bring about the natural progression of the disease, which will ultimately bring about the death of the patient. In order to better understand the dilemma, we must first look at the differences amongst the end-of-life options that are primarily discussed in the medical community. So, what is the difference between physician-assisted suicide, euthanasia, the double effect of palliative care, and death following the refusal of treatment? We can find these answers in an article in the Issues in Law and Medicine. John Gleason explains, assisted suicide occurs when a physician provides a patient with the medical means and/or knowledge to commit suicide. For example, a physician provides a prescription for sleeping pills to a patient and informs the patient what a lethal dose would be. In this case, the patient performs the life-ending act. Euthanasia occurs when a physician administers a death-causing drug or other agent. In that situation, the physician brings about the death of the patient. The purpose of palliative care is to relieve pain and suffering, not to end the patient's life. However, the patient's death is a possible side effect. It is ethically all right for a physician to gradually increase the appropriate medication for a patient, realizing that the medication may depress respiration and cause death. Finally, physician-assisted suicide must be distinguished from withholding or withdrawing life-sustaining treatment, in which the patient's death occurred because the patient or proxy decided that the disadvantages of treatment outweigh the advantages, and therefore treatment is refused. All of the results are the same. Ultimately, the patient dies. The differences are that in palliative care and discontinuing medical care, the patient dies as a result of the disease, whereas in physician-assisted suicide and euthanasia, the patient dies as a result of the drug which was given to the patient. So, what are the ethical and legal differences between withdrawal of treatment and euthanasia? We turn to an article in the Ottawa Citizen in which Margaret Somerville states, in withdrawing life-supporting treatment, the primary intention is to respect the patient's right to refuse treatment. In euthanasia, it is to kill the patient. The former intention is ethically and legally accepted, the latter is not. Now, proponents of physician-assisted suicide make their case from our Constitution. According to an article in the Public Interest, we learn that the cause for physician-assisted suicide come from the Due Process Clause of the 14th Amendment, which protects a patient's right to make immediate and personal choices. Timothy Quill provides this medical rationale. Because even the best palliative care cannot control some patient's suffering, doctors should be allowed to provide assistance in dying as a humane alternative. So, what am I suggesting to you? I'm suggesting that you take the time now to talk to your loved ones and family. Discuss with them what life-saving measures you want them to pursue should you be unable to make those decisions on your own. According to an article in the Wall Street Journal, more than 75% of people will be unable to make some or all of their own medical decisions at the end of life. Planning ahead for end-of-life decisions is meant to allow patients to reduce the amount of medical intervention if that is what they prefer. But patients can also make clear their wishes if they prefer maximum intervention. It is so important to make these decisions now, because if you are suddenly in a situation where a decision needs to be made, you often have a very limited amount of time. It is very important to also choose the person who will make those decisions for you. Oftentimes, a spouse or a significant other may know of your wishes. However, they would be unable to fulfill your wishes out of their own needs or grief. So be sure to discuss this with those you love. There's lots of information available on the internet. A good resource would be the National Health Care Decision Day website, which is nhdd.com. It has links to sources and legislation for each state. And I advise you, do this today. Don't wait until it is too late.